I'm Dr. Terry Dwelle. I am a pediatric infectious disease specialist and a public health specialist. I have worked in the Indian Health Service with the University of North Dakota School of Medicine for several years. We were missionaries in Central and East Africa for about 12 years. Then I was state health officer for 17 years for the state of North Dakota. And I'm now consulting at Turtle Mountain. So the first 6 years of our work in Africa was spent in northeastern Zaire. It's now called the Democratic Republic of Congo, at a hospital there called Nyankundi, and I was in charge of pediatrics and infectious disease. We had some tribal warfare towards the end of the 90s. Eventually ended up destroying our hospital. And we then moved our office to Nairobi, Kenya, and we started doing community engagement projects. That ended when the governor had asked just before 9/11 if I would be state health officer in North Dakota, and I spent 17 years doing that. When I was a kid, we were seeing all sorts of diseases that I had: chickenpox, measles, mumps. I went through them all, and many of those can be fatal. I've seen children die from measles, too many. Those are all vaccine-preventable diseases, and they still exist. We need to understand the importance of vaccines. One of the problems we have, I think, is misinformation. We need to provide important information. There's no doubt about that. Truthful information. Information that's based on facts. But we also need to encourage individuals to get their vaccinations because it does protect lives. Since the beginning of humankind, we have all been raised in communities. We depend on each other. And this, I think, gets down to the importance of community and community engagement in dealing with some of the factors that impact our health and wellness. We do need to care for each other. We need to identify those communities. We need to empower them, to encourage their members to be healthy and well. North Dakotans have always been optimistic. No matter what we face, we realize that there are solutions, and working together we can get to those solutions.